ROC is relationship-oriented care. It's patient and family-centered care. It's a model of care, a philosophy of care that always keeps the patient first.
ROC incorporates service excellence initiatives into its framework. So things that you see that are ROC but are also service excellence are things like hourly rounding, where someone is checking with the patient every hour to make sure that they're comfortable, that their position is correct. In addition, you'll see one-on-one communication about the relationship that the nurse and or others are providing to the patient, what that communication looks like. You'll see a lot of those initiatives then memorialized on our care and communication boards.
And what was interesting was one of our employees at the beginning of her shift wanted to ask a patient what he would like to be called, and the box that is noted is name preference. And this gentleman's first name was Aloysius. And so she asked him what he would like to be called, and he thought about it for a moment and said, well, you know, I'd like to be called Al. Now this was an elderly gentleman whose daughter was in the room with him, and the daughter was absolutely dumbfounded and said, Dad, Al, since when did you want to be called Al? And he said, all my life, but nobody ever asked.
The nurse shift reporting tool helps communicate key patient information between shifts. Some of this information includes diagnosis, history, diet, activities, and tests and procedures. Before the nurse shift reporting tool, each department and unit had their own paper-based process. Currently, all med-surg and critical care units have a standardized process. Now we can save 22 minutes per nurse per shift, and that's the time that can be spent at the patient's bedside.
The thing I like best about ROC is the patient focus. Most of us who are nurses went into nursing because we love people. We love to work with people, we're caring people. However, we get so task-oriented, so list-focused as nurses, it's hard to focus on something different. ROC really forces you to think about your patient first. What are your patient's needs? What are your patient's priorities? And then you can work your list into their day.
What I like most about the ROC philosophy is the ability to really get to know our patients. So often we go into patients' rooms and we think so much about what it is we have to do, and we have to check this off and complete this and do that and make sure the patient gets here, but we forget about the patient and the personal side of what it is they're thinking about, they're worried about, what they need, what they want. And this really connects us with our patients every single day and reminds us really of why it is that we chose to go into the healthcare profession.
The philosophy of ROC really says that patients and families are our first priority. It's very consistent with Oakwood's mission and vision. In addition to that, ROC allows nurses to really focus on what's important. It's their patient, it's their patient's relationship. And it really then builds the communication for the whole team to make sure that the patient is the center of why we're here and what we're doing on a day-to-day, minute-to-minute basis.